In this clinical teaching guide, we will discuss managing challenging learner behaviors in the teaching environment. Just one learner exhibiting challenging behavior can derail the educational experience for everyone in the room. Many of us feel uncertain or uncomfortable with handling these learner behaviors in real time and after the session. Here are 4 challenging learner behaviors that can arise in the teaching environment: withdrawal and lack of meaningful engagement, monopolization of conversation, disruptive interruptions, and argumentative interjections. Here are some solutions for managing a learner demonstrating withdrawal. Create psychological safety. Thank learners for their input. Remember that learners don't always have to have the right answers. They're learners after all. Remember that the learner is more likely to remember a negative response over a positive one. Lastly, respond positively to answers, even when the learner is incorrect. Next, implement helpful strategies for learning. Avoid calling on people individually to prevent embarrassment. Instead, use the think, pair, share technique to encourage students to bounce answers and ideas off each other. Utilize poll software to keep students engaged. Ask for feedback about your own teaching. If all learners seem withdrawn, you might be the one causing tension. Ask for feedback from other trusted educators to determine if a change in your teaching strategy is needed. Here are some solutions for managing a learner who monopolizes the conversation. Thank them for their comment and divert. Pose the question or input to the rest of the audience for feedback. This can double as an engagement technique for other learners. Express the value of hearing from all learners in the group. Clarify your expectations. Remind learners of session goals and time limits, and offer to set aside time after the session for discussion and open-ended questions. Next, offer an outlet. Unrelated questions can be a deterrence to learning, so offer an outlet for students to submit questions for later review. Break up learners into smaller groups. This will prevent one single learner from dominating the conversation. Here are some solutions for managing disruptive interruptions in the learning environment. Join the sidebar conversation. Ask the learners engaged in the outside conversation if they have any thoughts on the current topic they would like to share with the group. This will give the learners the benefit of the doubt that they were conversing about the central topic and will discourage the behavior if that wasn't the case. Use physical space. Sometimes standing close to the disruptors will stop the behavior. Ask them politely and directly to stop if the behavior continues. Request that they pause their external conversation and focus back in. Here are some solutions for managing argumentative interjections in the learning environment. Pause to center yourself before responding. Take a deep breath and thank the student for their point. Remain calm and non-judgmental, and give the student the benefit of the doubt. Focus on the content, not the emotion. Focus on what was said instead of how it was said. Consider the student's viewpoint to the best of your ability, and provide evidence to support your viewpoint. Normalize variations in practice. Explain that workups can be managed differently without being wrong, and that different approaches exist in the art of medicine. Share the rationale for your approach. Consider using the student's alternative point of view to spark a larger conversation within the group. Ask, has anyone else used this approach? Be inquisitive without being condescending. Ask the student for supporting evidence, as this will reveal if their claim is based in evidence or not. Then, promote an open-ended conversation. If you're unable to turn the student's argument into a productive conversation, it's time to move on. Offer time at the end of the session for further discussion. Here are some ways to deliver feedback in the conversation afterwards. In order for there to be meaningful change in a learner's behavior, the root of the problem must be found. Have an intentional one-on-one conversation with the learner after the session. Discover the learner's frame. What is the underlying thought process or feeling driving this behavior? Remember that different underlying issues can drive the same outward behavior. Here are some methods for framing this conversation. First, establish educational alliance by emphasizing that you are there to help and that you have the learner's best interest at heart. Use the SOAP framework, subjective, objective, assessment, plan, to determine the underlying causes of challenging learner behaviors. The first step in the SOAP framework outlines a subjective approach. The educator shares their own subjective experience resulting from the problematic behavior. How did you, the educator, feel when this behavior took place? The second step in the SOAP framework outlines an objective or advocacy inquiry approach. For advocacy, the educator shares a factual description of the problematic behavior they noticed. What exactly did the learner do that made you feel the way you did? Focus on the specific behaviors and actions that occurred. For inquiry, the educator shares their concerns about the behavior and asks the learner to share their thoughts about it. The third step in the SOAP framework outlines an assessment. The educator asks the learner directly about the cause of the problematic behavior. Be inquisitive and intentional. Why did the learner do what they did? What could be driving the undesired behavior? You will not know the reason until you ask, and the true reason may surprise you. The last step in the SOAP framework outlines a plan. Have the learner first suggest ways they think they can improve their behavior. Suggest modifications for the plan as needed. Remember, learners are more likely to be successful if they come up with a solution themselves. Solutions will fail if the learner is not on board. Be sure to establish accountability and implementation intentions. Implementation intention is a self-regulatory strategy in the form of an if-then plan that can lead to better goal attainment, positive habit formation, and behavior modification. Challenging learner behavior can signal a deeper issue the student is dealing with. If you believe a student is in distress, here are some steps you can take. Student safety is our top priority at the Burnett School of Medicine. If a student is in immediate danger, contact TCU Campus Police at 817-257-7777 as soon as possible. For additional concerns related to student safety and well-being, contact our Office of Student Affairs at mdstudentaffairs@tcu.edu. This video was produced by the Office of Faculty Affairs and Development. Thank you for watching.